New Zealand COVID-19 inquiry, horrific excess deaths. I have no idea what the pending New Zealand COVID-19 inquiry will ultimately conclude, but at a bare minimum, one would hope that it will recommend a better plan to handle the next pandemic if and when it occurs. The World Health Organization refers to the next pandemic as Disease X, but it could just as easily be Disease Y, they say.
The painful lessons we learned are in danger of being forgotten. If we fail to learn those lessons, we will pay dearly next time. And there will be a next time. History teaches us that the next pandemic is a matter of when, not if. It may be caused by an influenza virus or a new coronavirus, or it may be caused by a new pathogen we don't even know about yet, or what we call Disease X. We first used the term Disease X in 2018. It was just the same time I spoke here in this government summit in 2018. COVID-19 was a Disease X, a new pathogen causing a new disease. But there will be another Disease X, or a Disease Y, or a Disease Z. And as things stand, the world remains unprepared for the next Disease X and the next pandemic.
However, I find it disturbing with an inquiry imminent, that there is suddenly an increase in the previous government's tempo praising themselves, how well they handled the COVID-19 pandemic, and also repeatedly broadcasting how New Zealand had one of the lowest COVID death rates in the world. If this latter point was true, and it may well be, then there would be no need whatsoever to try and sell this success story beforehand to the New Zealand public and the world, because this fact would obviously come out in the inquiry's findings. Perhaps the failed ex-Prime Minister and various other Labour Party ex-Cabinet and health ministers, including Aisha Verrall, are trying their best to deflect the public's attention away from another serious matter, namely, New Zealand's horrific excess death statistics. It's also disturbing that the recent study was partly funded by the New Zealand Department of the Prime Minister and Cabinet and Ministry of Health, which used mathematical modelling algorithms to show that the vaccine saved many thousands of New Zealanders' lives. Yet this same report totally ignored the horrifically high excess death rate, and News Hub media outlet who covered the story never bothered to mention who the ministers were, and how the study was funded, who were the ministers involved, and did the Kiwi taxpayer fund any part of the modelling study. Why did this study come out now, just before the inquiry starts? I have some concerning charts and slides to discuss regarding New Zealand's horrific excess death rates, but firstly, listen to what the failed ex-Prime Minister Chris Hipkins has to say.
Will you be Prime Minister again?
I certainly hope so.
The government's consulting on expanding the COVID inquiry to include vaccine procurement and efficacy, the use of multiple lockdowns, and whether the goals of elimination were balanced with other priorities.
I think that an inquiry with a broader scope will certainly get more people making contributions to the inquiry, but it's not necessarily going to be a balanced response. You're going to get people making a response who have some form of grievance. You're not going to get submissions through a public submissions process from the people who are still alive today who wouldn't be had it been for the response. If you look at what they're proposing to do now, it's pretty heavily loaded. The reality is when we did a lockdown decision, it was because we didn't know what was happening. If you look at New Zealand's overall vaccination rate when COVID-19 arrived, and the mortality rate, the number of people who died from COVID-19, it was a fraction of what it's been elsewhere around the world. And of course, vaccination was the key reason for that. Let's let the results speak for themselves. The results were pretty clear. We had one of the lowest death rates of COVID in the world. Let's let the results speak for themselves. The results were pretty clear. We had one of the lowest death rates of COVID in the world.
Will you be Prime Minister again?
I certainly hope so.
A high-level inquiry into the pandemic and its management. We had lockdowns, we had separation, we had a whole range of psychological problems emanating, and there is also this extreme, unexplained, so-called unexplained increase in death rate. We need to find out exactly what the decisions were and how those decisions were made.
Now I would like to present some data charts which highlight New Zealand's horrific excess death statistics. This information has been put together from recently obtained data from the World Health Organization, OECD statistics, and our World in Data. The charts have been updated with comments where appropriate, to make the data easier to follow and understand. What is excess mortality? Excess mortality is a term used in epidemiology and public health that refers to the number of deaths from all causes during a crisis, above and beyond what we would have expected to see under normal conditions. In this case, we're interested in how the number of deaths during the COVID-19 pandemic compares to the deaths we would have expected had the pandemic not occurred. A crucial quantity that cannot be known but can be estimated in several ways. Excess mortality is a more comprehensive measure of the total impact of the pandemic on deaths than the confirmed COVID-19 death count alone. It captures not only the confirmed deaths, but also COVID-19 deaths that were not correctly diagnosed and reported, as well as deaths from other causes that are attributable to the overall crisis conditions. The borders are closed on the 19th of March 2020, week 13. Shortly afterwards, you can observe an immediate decline in excess death rates, possibly because any fatal illness, disease, or coronavirus has now been greatly restricted from entering into New Zealand. Interesting pattern of OECD excess death rates in 2021. Even with the borders fully closed throughout the full year, the death rates were higher in the first and last quarters. The borders were reopened on the 27th of February 2022, week 8. Then a horrible year for excess death rates, becoming one of the worst in the world, soaring above 20% and peaking over 30%, even with high vaccination rates being achieved. 2023 is another bad year for New Zealand excess death rates, starting the year at over 30% and staying high for nearly 6 months, then dipping a little, before rising into the 20% range for the last 2 months of the year. New Zealand's excess death rates for 2022 and 2023 are absolutely shocking, one of the worst in the world. But what is even worse, is the deafening silence from the failed Labour Party government and the left-bent, bribed, corrupt, dishonest, woke, mainstream New Zealand media. This chart is from the World Health Organization, and summarizes COVID-19 cases submitted to the WHO from the Western Pacific. New Zealand's borders were closed from the 19th of March 2020 through to the 27th of February 2022. So there would have been very few COVID-19 cases to report to the World Health Organization during this period. New Zealand's excess death rate steadily increased from early 2021 to become one of the highest in the world during 2022 right through until the end of 2023, with horrific rates peaking over 30% at times. This chart summarizes the OECD data for New Zealand 2020 to 2023, and it's not exactly a success story in my view. In fact, the New Zealand excess death rate statistics are horrific. COVID-19 vaccination in New Zealand began on the 20th of February 2021, week 7. The excess death rate steadily increased from early 2021 to become one of the highest in the world. The reasons for these excess high death rates have never been publicly addressed by the failed Labour Party government, or worse still, by the mainstream New Zealand media. However, the Labour Party Prime Minister and other cabinet and health ministers have often bragged about how New Zealand had one of the lowest COVID-19 death rates in the world. This then begs the obvious question: if not COVID-19, then what is causing these horrific New Zealand excess deaths, and why the silence? This chart from Our World in Data makes it quite easy to summarize visually how bad the New Zealand excess deaths rates really were. The chart covers from the start of January 2020 to the end December 2023, quite frankly, 4 years worth of misery. Borders closing, vaccinations underway, borders opening, and then excess deaths soaring, with several instances of deaths peaking at over 30%, which is horrific. But total silence, not a peep from the failed Ardern Hipkins Labour Party government, or the left-bent New Zealand mainstream media. Why? The job of any government is first and foremost to look after and protect its citizens, but this silence and lack of caring is an enormous failure of government, and in my view, Many of the associated MPs, academics, and the media are guilty of gross professional negligence. This moving graph chart is from Our World in Data, and shows New Zealand's excess death rates from the start of January 2020 through to the end of December 2023 for all age groups as shown. Unfortunately, the graphs reflect a depressing picture which I will now cover in more detail in the following summary slide. There's a lot of information displayed here, so I suggest that you pause the video and have a really good review of this presentation slide. It's a bit of a sad eye-opener unfortunately, and it's definitely not something to be proud of, or silent about. In summary, all age groups from youngsters up to 14 years of age, right through to the elderly over 85s, all experienced rising excess deaths rates from early 2021 onwards. All age groups also experienced average high death rates ranging from about 15% to 25%, and peak excess death rates ranging from 23% to 44%, which is quite horrific. The chart also details when COVID-19 vaccinations began, and when the borders were closed and reopened. It's worth taking some time to pause this video clip and take a long hard look at these figures. They are very sobering, because New Zealand's high excess death rates badly affected all age groups, not just the elderly, as we often hear mumbled around the traps. How any Prime Minister, or Cabinet Minister, or Health Minister, could betray the public in this manner by keeping silent on such horrific statistics, and equally so, how even a left-bent corrupt mainstream media could also remain silent, defies my imagination. We've had damehoods and knighthoods, we've had preaching from the political pulpit, we've had no jab, no job mandates and deadlines, we've had lockdowns, social distancing, and separation. We've had how great the government handled COVID-19. We've had nobody was forced to vaccinate, they had a choice. We've had one of the lowest COVID-19 death rates in the world. We've had total and utter silence on New Zealand's horrific excess deaths. Why the silence on New Zealand's horrific excess death rate statistics? Why? Surely, if the failed Labour government ministers can keep bragging about how we had one of the lowest COVID-19 death rates in the world, and also for some secretive reason, find the time and money to fund an expensive professor mathematical modelling program to support their great achievements, they would also find the time to publicly address our horrific excess death rates. Maybe the pending New Zealand COVID-19 inquiry will be able to find out why this deafening silence, but please don't hold your breath waiting. In the meantime, as mentioned earlier, there is another question that still needs to be addressed and answered, as follows. If New Zealand did have one of the lowest COVID-19 death rates in the world, but also had one of the highest excess death rates in the world, as has been substantiated in this video from readily available public data, then, if not COVID-19, what caused these horrific excess death rates? Maybe the New Zealand COVID-19 inquiry will address that question. Finally, please listen to some closing comments I extracted from a recent Dr. John Campbell's YouTube video titled Ignored Excess Deaths, which sum up perfectly the mind-boggling deafening silence from government and the mainstream media. Please watch John's full video for further numbing excess death global statistics. The link is listed below and in the description. Thank you for listening. Geraint, on behalf of WhangareiTim.
The excess deaths in 2022 and 2023. What do we hear about this from mainstream politicians and mainstream media? What do our current generation of politicians do? Walk out the chamber when someone tries to talk about it. What the heck is going on here? These data presents the latest data on all-cause death statistics, excess mortality and COVID deaths by week for all OECD countries, for which data is available. And you can download this. You can download the spreadsheet of deaths in 2023, 2022. This is what I did. And download the spreadsheet straight into Excel. It's really easy. Right. So there we have it. Why is there a deafening silence? Why do MPs walk out the chamber when this is discussed? It's enough to make you suspicious. It really is enough to make you suspicious. Why don't the members of Parliament even listen to the detailed arguments put forward? Put questions into the public domain because we're being let down by other communicators, in my view. So it's just those numbers buzzing through my head. You know, each of those numbers is a human being. It's just, and yet, I'll leave it there. Thank you for watching.
Special Addendum. Belated New Zealand Government eulogy to excess deaths. There are MPs, and then there are MPs. Member of Parliament. Mr. Collins, a New Zealand Green Member of Parliament, passes away suddenly, and there is an outpouring of sadness and sorrow in government. Then Parliament is adjourned as a mark of respect for him. The mainstream media are full of endless praise for Mr. Collins. Member of Public. John Doe passes away suddenly as an excess death statistic, and there is total silence from the government and from the New Zealand mainstream media. Why? The following belated messages are for these people, for all unknown members of the public who the government and media didn't show any respect for. Rest in peace.
I want to begin by extending our thoughts to the family and the loved ones. The loss of a husband and a father is never easy, but to do so in such tragic and sudden circumstances makes it that much harder. And I know all of our thoughts are with them today.
Today we say goodbye to an extraordinary man, a community leader, a father, a husband, a brother, his beloved family, his wife and their 2 daughters. You gave him strength and purpose and joy and friendship and love and support.
Te Pāti Māori, share in our condolences for the devastating loss. Our heart goes out to his wife, his children, his parents and his communities. We are so grateful for their generosity in sharing him with us. We can only imagine the gap that he leaves for his whānau.
Let's let the results speak for themselves. The results were pretty clear. We had one of the lowest death rates of COVID in the world. The results speak for themselves. The results were pretty clear. We had one of the lowest death rates of COVID in the world. Let's let the results speak for themselves. The results were pretty clear. We had one of the lowest death rates of COVID in the world.